Good day everyone. We're here to present the four large associations of retailers which are National Retail Federation or NRF, Food Marketing Institute or the FMI, National Association of Chain Drugstores or the NACDS, and lastly, the National Association of Convenience and Petroleum Stores or NACS, including the latest retail development and issues confronting the industry of each association. But first, let me introduce myself. I am Mary Ann Macarasig together with Alan Calamba who will appoint to discuss the first association which is National Retail Federation or NRF. To be able to understand well, let me define first what NRF means. NRF or the National Retail Federation, it is the world's largest retail trade association with over 3.8 million retail establishments as members. NRF is responsible for representing companies in the retail sector. They include department stores, specialty, discount, catalog, internet, and independent retailers, marketing companies, chain restaurants, grocery stores, and businesses that provide goods and services to retailers, such as vendors and technology providers. The next is the latest retail development. Average Easter spending expected to be highest on record. In Washington, consumers plan to spend an average of $179.70 this Easter. It is according to results of the annual survey released by the National Retail Federation and Prosper Insights and Analytics. It is the highest figure on record. This $179.70 is average spending per customer with a total spending of $29.6 billion. Easter gifts, food, and candy are the biggest drivers of growth this year, meaning these three are consumers' top planned purchase. NRF annual Easter survey shows how consumers will be embracing the holiday despite of pandemic. It is because they are confident with the positive trends of vaccination. With new stimulus funds from the President's American Rescue Plan, positive trends in vaccination, and growing consumers' confidence, there is a lot of momentum heading into the spring and holiday events like Easter. It is said by NRF President and CEO, namely Matthew Shea. Due to the increasing number of vaccines, consumers tend to celebrate Easter holiday with their families. They able to gather because they've already vaccinated. Imagine 8 out of 10 consumers are planning to celebrate Easter this year. With this, it empowers the industry to power the economy. The next part who will discuss the latest issue confronting the industry, none other than Mr. Calamba.
Thank you, Ms. Makarasig. Today, I am going to discuss about the latest issues confronting the industry. But before that, let me introduce myself first. My name is Alan Calamba, and the latest issues confronting the industry includes coronavirus retail restriction by state. This resource is a part of Operation Open Doors. So the resources and information below were provided by state and local government agency through our state retail association partners, and for the operation of Open Doors, which provide guidance and tools that NRF members can use as they navigate operating stores across the country during this international health crisis. Using map outlines. By this, using map outlines can monitor coronavirus related by laws, executive orders, regulation, and guidance governing stores operation for retailers. And for the update of map of month of June includes enhanced data categories and visualization, specific guidance by jurisdiction, country or city, COVID-19 cases visualization. Thank you.
I am Pauline Chisuroy, and I will discuss the Food Industry Association or FMI. The Food Industry Association (FMI) is based in Arlington, Virginia. It is an American trade association for food marketing, food retailers, and wholesalers. FMI is the champion for feeding families and enriching lives with nutritious, safe, and affordable food at retail. So now, their latest retail development is the evolution from research to insights. It is about conducting research and develop it so they can provide the industry and insights. In 2017, the Insights Association was born from a merger of two long-standing research associations, which are the Castro and EMBRA, where they provide one ways to advocate for marketing research and analytics, supporting with unprecedented resources the companies and individuals engaged in this important work. According to Steve Markinson, a director and a researcher at FMI, in his over 30-year career, the industry has changed dramatically. But in his almost 4 years at FMI, the speed of change has accelerated. How they use their research to provide their members and the industry with valuable insights in myriad ways. As the Food Industry Association, FMI is uniquely positioned to provide objective research and insights on the industry. Grounded in solid research, they publish important insights about the food industry. This starts with their two signature publications, which are the U.S. Grocery Shopper Trends. It is about an insight where it provides the industry insights on consumer grocery shopping behaviors. And the next one is the food retailing industry speaks. It is an insights into what is happening in the industry for 72 years. The COVID-19 pandemic has served to accelerate change and expand FMI's portfolio. In 2021, they will be exploring a range of issues, such as a refresh of retailers' contributions to health and well-being. And the second one is a look at supply chain issues in the food industry during the pandemic. And the last one is a look at workforce attractiveness in the food industry and the future of work. These FMI publications are not static. You will see insights from them in blogs, social media, pages, webinars, podcasts, articles, coverage industry press as part of FMI conferences, and so much more. All of this is to evolve the research from findings to insights and on for the food industry. So the next topic is about the latest issue confronting the industry, to be discussed by Andrea Bohol.
Thank you, Ms. Pauline Suroy. So I will be discussing the latest issue confronting the industry, which is limited vaccine for workers in food industry. So first is FDA rules. So FDA rules means Food and Drug Administration. So sila yung may power or may kakayahan mag-authorize, mag-approve ng mga business about food and drugs. Like na nakikita nyo sa business online na may pinapakita silang paper ng kanilang product and na paper ng FDA na approve silang mag-operate ng business nila. Kaya sila din yung may authorize about the vaccination for COVID-19. So dahil nga sa limited pa lang yung vaccination na ginagamit, CDC or Centers for Disease Control and Prevention nag-provide sila na recommendation sa government kung sino muna yung pwedeng magpabaksin. So, yung CDC's recommendations are based on those of ACIP, Committee on Immunization Practices. Sila yung mga independent panel ng medical and public health experts. So, according to CDC's recommendation, food and agriculture workers are included in phases 1B. Which is yung 1B is yung food and agricultural workers and grocery store workers. And 1C is food service worker, which is mga service crew like service crews in fast food chain, which is like McDonald's and Jollibee Group. How can I get access to COVID-19 vaccines for my food and agriculture sector employees? So, CDC makes the recommendation each state has its own plan for which group of people will be vaccinated first. You can contact your state health department for more information on its plan for COVID-19 vaccination. So, sinasabi lang ng ang recommendation ng CDC na yung bawat bansa is magkaroon ng sariling plano about kung sino yung unang mababaksinahan ng COVID-19 vaccine. And if gusto mo malaman yung information about COVID-19 vaccine is kumonta ka lang or pumunta ka sa government state natin kung gusto mo malaman yung plano nila about vaccine kontra COVID-19. So next is benefits of vaccine to the workers in food industry. So first is vaccination will help keep you from getting COVID-19. Siyempre, pag nabakunahan ka na ng vaccine, syempre, hindi ka na agad-agad magkakaroon ng COVID-19 na coronavirus. So, next is vaccination is a safer way to help build protection. Syempre, hindi ka na basta makahawa ng COVID-19 or ng coronavirus kasi nga, may protection ka na at ayun yung vaccine. So, next is vaccination will be an important tool to help stop the pandemic. Syempre, dahil nga, di ba, mabilis yung paghawa ng COVID-19 sa mga tao. So, syempre, dahil nga may vaccine is magkakaroon na ng medyo hindi na masyadong madae o patuloy yung paglaki ng mga nai-infect ng coronavirus. So, may stop talaga siya. And the next reporter will be Anlin Desena.
Thank you, Ms. Bohol, for that wonderful presentation. I am now the next reporter. I am Anlin M. Desena that will report about the NACDS, its latest development and latest issues. National Association of Chain Drug Stores, or NACDS, focuses on advocating for pro-patient and pro-pharmacy public policy, communicating the value of community pharmacy as the face of neighborhood healthcare, and fostering business community and solutions through effective meeting and other member programs. I will talk about the latest development happened to them by discussing the following. NACDS Regional Chain Conference underscore resilience, commitment, community focus of retail pharmacy throughout COVID pandemic. The National Association of Chain Drug Stores report on the organization's position of strength in the healthcare, retail, public policy, and political environment. A consistent theme emerged NACDS focus on value and on industry relationship fuel its success. That is why they arrived in expanding relationships. It's centered on the NACDS members' ongoing commitment to meeting communities' health and wellness needs throughout the COVID-19 pandemic and beyond. According to Craig Norman, the NACDS Regional Chain Conference Chair and Senior Vice President of Pharmacy for HEB, talk about the unexpected challenges that the industry faced. He described shifting dynamics in the political environment, in retail, and in healthcare. Specifically, he noted changing trends in fulfillment demographics, shopper behavior, wellness, and personalization. He also emphasized the importance of improving efficiency to better meet the needs of customers, focusing on healthcare affordability and price transparency, while highlighting opportunities to maximize efficiency and experience through retailers' partnership with suppliers and wholesalers. Technological solutions such as e-prescribing and new pharmacy services. Rick Kayes, the NACDS Board of Director Chair, President, and the CEO of Meher Incorporation, discussed the member exchange operational safety excellence, from forklift pedestrian safety to measuring company safety performance and everything in between. This roundtable session will provide attendees the opportunity to interact and exchange best practices with other member companies. He also discussed the compliance safety accountability. They will share the 4 behavior analysis and safety improvement categories, or the basics, and the top violation of each that create trouble for many couriers, along with the actionable ways to improve compliance safety. Accountability scores. NACD and its over 440 members companies are vital to the chain, providing the products to over 750,000 end users. Furthermore, Lynn Fruth, the member of the NACDS Board of Directors and President of Fruth Pharmacy, talks about the in-depth discussion of COVID-19 related issue. The robust response to the COVID-19 pandemic from the regional chain was the result of the preparedness and the willingness to work with the state and federal leadership. Fruth noted that one of the key elements of the Point Pleasant-based chain was being proactive when it came to providing COVID-19 testing and more recently vaccines. She also talked about the being proactive also meant reaching out to the government leaders to make clear the chain's value to the healthcare system during the pandemic. Ultimately, Fruth noted that regional chains' strength lie in their knowledge of their patient base and the geographic footprint. On the other hand, Steven Anderson, the president and CEO of NACDS, stated that a prognostic COVID-19 severity test has been launched in the United States for the identification of high-risk individuals who are likely to experience the most severe COVID-19 complications upon exposure to the virus. Requiring only a routine blood draw, the test can help identify those who would require hospitalization in intensive care unit support. Additionally, the test may be beneficial for managing care among the patients who are immunocompromised, as well as for those who may not be able to get vaccinated for other medical reasons. Anderson also said that the CST may also be beneficial for individuals who are already known to have a high risk of severe or critical disease by allowing for increased infection mitigation, early aggressive medication upon infection, or other early intervention in the event of the SARS-CoV-2 infection. I will now discuss the latest issue facing by the NACDS by discussing the article. NACDS to engage health local department leadership on pharmacies' community level role in COVID vaccination effort. NACDS is proud to be working alongside with the National Association of County and City Health Officials, or NACO, a community-focused organization with a strong history of advancing public health preparedness and serving communities in times of crisis. The collaboration between highly trained and trusted pharmacists and community health leaders has powerful implications when it comes to closing the gap on the vaccination administration, particularly in those communities in need. Pharmacies are uniquely positioned to get COVID-19 vaccination into armed safety efficiently and equitability. There is a pharmacy within 5 miles of 90% of Americans, and pharmacies have the capacity to meet the demand for 100 million vaccinations in 30 days. NACO continues to support and advocate the local health departments will have this ability around vaccine allocation within their communities and to encourage partnerships with critical partners such as pharmacies. According to the NACDS, federal government has recognized the impact of leveraging pharmacists within communities and have issued guidance and advisory opinions authorizing pharmacies to do COVID testing, provide childhood vaccines, and have also granted authority to pharmacy techs and interns to provide testings and vaccines. Next reporter will be Jessa Guillermo that will talk about the NACS or the NACS together with the latest retail development and issue confronting the industry.
Next is the National Association of Convenience and Petroleum Store, or NACS. NACS is the leading global trade association dedicated to advancing convenience and fuel retailing, serves as a trusted advisor. This serves the convenience and fuel retailing industry by sharing ideas and insights, creating unique networking and education opportunities, and through industry-leading research and analysis. Here is the latest retail development of the association, which is the NACS Foundation Scholarships Supporting Bright Future. NACS Foundation Scholarship is one of the Future Fund program, serves to fund the development and growth of convenience store employees and their family members by investing in their education with NACS industry support. They also provided convenience and fuel retailers a way to retain, reward, and develop the next generation of industry innovators within their companies. Scholarship recipient will receive allowance. Scholars will receive $3,000 to cover undergraduate or community college tuition costs. And here is the latest issue confronting the industry, which is the COVID-19 liability. Thousands of COVID liability cases have been filed to date, and this number continues to grow. At the onset of the COVID-19 pandemic, the Department of Homeland Security issued guidance designating certain businesses as critical infrastructure, including the convenience store industry and its supply chain. The convenience store industry has been committed to staying open during this time of crisis when Americans need them most to provide fuel, food, beverages, over-the-counter medication, and other goods and services. Businesses have worked hard to overcome numerous hurdles such as constantly changing health guidelines and supply shortage.
Despite their best efforts, these businesses could face exorbitant civil suits alleging that individuals contracted COVID-19 at one of their locations simply because they have been open and operating during the pandemic. Next is NAC's position. This is the stand of NACS regarding to that issue. The businesses that answered the call to serve their communities when the country needed them the most need reasonable liability protections. It's critical that Congress pass legislation providing liability protection to businesses for the duration of the national public health emergency. Legislation should not cover bad actors, but only those businesses who prioritize the safety of employees and guests and acted responsibly to mitigate the spread of the virus.